Okay, I'm assuming that the technology is working. My welcome to everybody who has joined our conference today. This is one of our State of the Science sessions. And as I will mention in a minute, this has been one of several such sessions that we have held over the past several years. It's an exciting time to be able to exchange ideas and thoughts, and we have a special presentation, special series of presentations for you today. Next slide, please. Just to provide a little bit of background, the presentation is being put on by the Southeastern Coastal Center for Agricultural Health and Safety. We are one of 11 such centers around the country. These centers have been being funded since 1990. Our particular center has been funded since 2016. And again, we're very pleased to be able to put on this presentation, both for members of the center here, as well as others in other parts of the country. Next slide, please. Just as a quick review, our Southeastern Coastal Center for Agricultural Health and Safety covers 8 states and territories, 7 major universities. We have a strong link with the Extension Service, as well as with a variety of community partners. Next slide. Our research highlights over the last several years, 63 peer-reviewed published articles, a number of major projects looking at pesticides, heat stress, some work with social marketing, occupational safety and surveillance of Gulf seafood workers, as well as work with mental health and resilience. Next slide. We have also had a number of different pilot projects. You're not supposed to necessarily be able to read the fine print here, but again, I think this simply reflects the range of activities that have been done by our investigators within the project. Next slide. We have had, this is 3 previous State of the Science meetings. This is the 4th such meeting. These are annual symposia designed to educate members of our academic community, as well as frontline professionals on clinical and public health science, which hopefully will drive new thinking on emerging issues among agricultural, fishery, and forestry's workers. The first conference we had was in 2018, talking about heat-related illness, 2nd on stress and resilience, 3rd on global pandemics, and again, now the conference that we have today, Pathways to Health Equity in Agriculture, Fisheries, and Forestry. I will say that we continue to have a major concern with regard to pandemics, and in particular COVID, which has had a major impact on workers in a variety of areas. Next slide. We have had, I would note, a series of webinars over the past year that have placed a fairly strong focus on COVID and activities to prevent COVID. Next slide. I would also note that we have COVID-19 resources and a COVID-19 vaccine communication toolkit. For those of you not familiar with these, I would encourage you to go to our webpage and again, feel free to download the communication toolkit. Hopefully it will be of value as you within the areas that you are currently working. Next slide. So the meeting today, the meeting goals are to share an overview on health equity challenges and opportunities across agricultural, fisheries, and forestry, as well as to foster ideas and collaboration among industry leaders to improve health and safety outcomes in the region. In particular, we are focusing on areas related to extensions, updated national health equity framework, on COVID-19 communication, especially within rural and minority populations, and injury prevention and surveillance. And I think that's the last of my slides. And at this point in time, we will move to the first session. Ricky?
Great. Thank you so much, Dr. Morris. Hi, everyone. My name is Ricky Telg. I serve as the director for the UF Center for Public Issues, Education, and Agriculture Natural Resources. I'm also a co-principal investigator with the Southeastern Coastal Center for Agricultural Health and Safety's Outreach Corps. And it's my pleasure to host the first panel in today's State of the Science meeting. We have 3 presenters and a short video in the first session that will provide an overview of health equity as a research practice.
Ricky, I'm sorry, Dr. Telg. We're going to move to the second session. So this one will end, and then we'll join in the next session on the left-hand side of the screen.
Okay.
Yeah. And then we'll get started at that session. Will open up at 10:20, 5 minutes before. So then everyone can take advantage of the networking while they log on. And we'll go ahead and enable the speakers for that session next.
Okay.
Okay. Awesome. Thanks, everybody.